This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Our next guest is Dr. Brent Thiel, an orthopedic surgeon with Western Washington Medical Group in Everett. Shoulder injuries and the correlation between those shoulder injuries and gymnasts, Shannon, and that makes a lot of sense, doesn't it?
It really does. Gymnastics, I mean, we watched it just recently at the Summer Games here, and, you know, those folks, obviously very athletic, but they put their body, and particularly their shoulder, in a lot of awkward positions, and Dr. Thiel is going to talk about potential injuries in gymnasts of the shoulder.
All right, Dr. Brent Thiel and Shannon O'Kelly.
Dr. Thiel, welcome to Health Talk. How are you?
I'm good.
Thanks for joining us. I'm excited to talk to you. You know, shoot, I see you in the neighborhood up there in Everett all the time, walking your dogs. You and your wife are out walking. Beautiful dogs, by the way.
Oh, thank you.
And yeah, I was looking at your bio, and you're from the Northwest. I think you grew up in the Northwest, attended college here. I wanted to find out a little bit about your background, but before we get there, I also saw that you served 3 years in the Navy, and I want to be the one to say thank you for your service.
Yeah, you're welcome.
Yeah, it's pretty cool. So you've been around. You've been doing a lot of stuff in the Everett community, kind of Linwood, Edmonds. You're an orthopedic surgeon, but give us a little bit about the day in the life of Dr. Thiel, your background, how you got to where you are.
Okay, well, so grew up in Bremerton, went to Bremerton High, graduated in '84, went to Seattle Pacific University for undergraduate. My wife, we were just friends at the time, also went to Bremerton, and she was a gymnast at SPU. And I was a gymnast in high school, but not through college. But anyways, so was helping out with the team quite a bit, and just saw a ton of injuries that these girls were going through, and that kind of piqued my interest in medicine, and that kind of snowballed from there.
And so you went to, I believe you went to Midwest, like Wisconsin, for medical school?
Correct. So yeah, so after SPU graduated in '88, went back to Wisconsin for med school in Milwaukee, Medical College, Wisconsin. It used to be Marquette, and then graduated, and then came back to the Seattle area for a surgery internship, and then matched into orthopedics, went back to Wisconsin for another 5 years.
Wow. And then joined the Navy. I mean, we're in the Navy for a little while.
So the Navy has what's called a health professional scholarship program, and so they basically pay for med school, and you owe them year for year. So they paid for 4 years, so I owed them 4 years of active duty. So
interesting. And you just made recently I would call it kind of a change. You just joined a new organization. Maybe talk about where you're located now.
Yeah, so joined Western Washington Medical Group a couple months ago. A little smaller group, a little more control over how we do things, and not such a big corporation. So so excited about it. It's a small group. It's so there's 5 surgeons, and so it's gonna be good.
Sure, that fits your style. I've known you. We've been on the football field together over the years. I mean, I've always found you to be really interested in, not just the physical aspect of your patient, but you always have seemed to me someone who's very interested in kind of the overall mental health and kind of a well-being of your patients. I think being able to do that in a small organization probably is pretty cool for you.
Yeah, it is. It's kind of brought back why I went into medicine, to take care of people and kind of get them back and doing things that they want to do, and not being told by corporate how to do things.
Right. Okay. So. We need to talk offline sometime. So here's the deal. So we're going to talk about the shoulder, and specifically we're going to talk about the shoulder as it relates to athletics, but even gymnastics. I mean, we all know their joints go through a lot of interesting movements and mobility. We're going to talk about the shoulder and injuries that we can see in gymnastics, but let's talk about anatomically. Let's set the shoulder joint up, because it's a fascinating joint. Why don't you give us a little anatomy 101?
Sure. So basically, the shoulder joint's a ball and socket joint. It's supported by the scapula, which is your shoulder blade essentially, and there's 26 muscles that are attached to that shoulder blade. So there's a lot of interesting, intricate things that shoulder blade does. It's basically the foundation for the shoulder joint. And then the ball and socket joint, and that's made up of cartilage and a structure called the labrum, which is kind of like an O-ring in the joint itself. And then the rotator cuff tendons are basically the muscles around that joint that support the joint.
You have this large ball in a small socket, and that configuration from a mechanical standpoint lends that joint to a lot of mobility, and with mobility comes instability or potential for soft tissue injuries.
Correct. Yeah, there's a lot of the shoulder. It has a huge range of motion. And that labrum is really important to provide stability to that joint. And there's a lot of things that can go wrong that lead to people needing to see me to get through either their injury or potentially even needing surgery.
Back with more with Dr. Thiel and Shannon O'Kelly next on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
We continue now with our conversation on shoulder injuries and gymnastics with Dr. Brent Thiel and Shannon O'Kelly.
Dr. Thiel, again, thank you for joining us. Health Talk. Thank you for taking time out of your day. And congratulations on your new practice there in Everett at Western Washington Medical Group.
Thank you.
We're talking about the shoulder joint. I love the joint myself. It's my favorite joint, but it's an interesting joint. You talked about things that can go wrong, particularly in athletics, gymnastics. Talk about that.
So most injuries are related to overuse stuff with athletes, but they can lead to some pretty dramatic problems. The labrum's the main one in somebody that's young. Either they have a subluxation or they have a true dislocation, and they tear that labrum, and then that labrum has a really hard time either healing or going through, and then they lead to recurrent issues with stability wise.
So that labrum is cartilage that sits on the outside of that socket, kind of creates a deeper pocket for the ball. And if that shoulder joint dislocates, that ball tears that labrum off. That labrum is a type of tissue, not a huge blood supply, kind of difficult to heal sometimes.
Yeah, it is. It's kind of an avascular structure, and typically what happens when you tear it is it tends to heal in the wrong position, and then what happens, it leads to recurrent stability and pain issues.
And it can tear in different spots, what probably makes your job kind of interesting, because you're probably going to identify where is this torn at. How do you figure out where it's torn at? I mean, is there a special test you like to use?
So you can do a lot on a physical exam, find out where their pain is, if their pain is posterior, anterior, if they're apprehensive, where you rotate them in certain positions and test that labrum. Most labral tears are usually anterior, but we do see a fair number of posterior ones from athletes.
And when you tear that labrum, you're kind of creating some internal hypermobility, some intrinsic kind of problems then, aren't you? I mean, and
Correct.
it probably needs to be looked at to be repaired then?
Most of the time they do. Yeah, some people can, if they have a real small tear, they can rehab it and they can get through without having anything done. But usually, if it's a significant tear, they need to have it fixed.
And in your hands as an orthopedic surgeon specializing in the care of sports medicine, and I know you like the joint, shoulder yourself, what does that look like? Minimally invasive surgery?
Yeah, so most of the surgeries nowadays we do are arthroscopic surgery. So little poke holes, camera goes in little poke holes, and we've found ways around important structures to protect them, but to get into the joint to do the work we need to do. So yeah, so minimally invasive surgery, basically going in there with their camera, and then putting little anchors that have suture and basically sewing that labrum back to where it's supposed to be.
Oh, it's fascinating. I mean, for you listeners out there, I know this is visually hard to understand, maybe, but these little poke holes, putting these instruments in, this is minimally invasive. You're looking at the inside of the joint on a camera, so less disruption to the tissue, smaller incisions.
Yeah, so minimally invasive, we're basically trying to protect the structures on the shoulder but repair the part that's torn. Yeah, so most of the time people can get back a lot quicker, a lot less pain. Sometimes they don't, they still want to get back quicker than we want them to because we got to give that tissue time to heal. That's usually the hardest part with mostly athletic people.
Well, there's obviously there's biology involved here. Yes, you have to let the tissue heal, but as far as return to activity goes after one of these procedures, I mean, it's pretty good. I mean,
yeah,
people are getting back to those what they want to do.
Yes, they are. It may take them months, not weeks, but yeah, they're usually getting back to being able to do what they were doing before.
Excellent information. Once again, thank you so much for joining us here on Health Talk.
Sure, you're welcome.
You've been listening to Dr. Brent Thiel. More information at www.medgroup.com. He is with Western Washington Medical Group in Everett, and those shoulder injuries. Shannon, I know you guys treat and rehab a lot of those.
Oh, we treat a lot of shoulders, and it's kind of a joint. It's my favorite joint. It's a very special joint to me because it does so many cool movements, but it is also susceptible to so much overuse and trauma just because what we do with it.
My favorite joint's down at the corner of Main and Post, but we can talk about that later. Thanks to Dr.
I know. I've seen you there.
Thanks to Dr. Thiel for being with us. We'll be back with our final segment after this timeout on Como.